Or I forget. And then, yeah, we'll get started, and we'll just kind of go around, and I'll start with Kelsey, if you want to just introduce yourself.
Hello, I'm Kelsey. I actually met Margaret through our doula training course with NARI, and so I am a certified birth doula, and then I'm in the progress of becoming a pediatric sleep consultant. So I'm actually finishing my last assignment, and then hopefully my goal is to finish this month. And then I haven't really, I've had 3 births that I've attended so far, and I plan to leave my job in the next 6 months. So once I leave that, then I'm going to just dive right into the birth world. And so right now I'm just taking those 6 months to take as many classes as I can. So after this one, I'm going to have maybe 4 other classes I'm going to take. So
Cool.
I'm excited. I'm ready for a new start.
All right, and I'm Margaret. I'm the host here of the Home Birth Café, and I come from 22 years with a nursing background, and dove head first into the birth world. And my concentration is for home birth, and yeah, so it's been exciting and growing the business. And I met Jenny about probably a little over a year ago, because I just feel like there's a real importance for pelvic floor health, for pregnancy, birth, and postpartum. And then also just for my own issues, I said, oh, I got to find out what's going on with myself. So that's how I met Jenny. And it's been an honor to get to know her and be a part of her world. And I've learned a lot from her. So I'm so glad you're here, Jenny. And I'm going to let you take it over and just introduce us, and then we'll have some questions for you.
Okay, cool. Well, thanks for having me, first of all. It's like, if this is the way we catch up, then great. So my name is Jenny Putt. I'm an orthopedic certified specialist, like physical therapist. So what we think of when we think of traditional physical therapy, but then also a pelvic floor physical therapist. So I did additional training, pretty much to be qualified to do internal work. And I've, dabbled in all sorts of different, interests and specialties. I've been an athletic trainer at a high school, so I've done a lot of sports stuff. But lately I've settled into kind of the perinatal pelvic floor, pretty much because 5 years ago, I went through the journey myself and just recognized how necessary the care is for pelvic health, just in the perinatal timeline, we'll say. I mean, generally speaking, it's important, but even more in the perinatal time, and then just how a lack of care there is, especially in the postpartum. There's so much hype over, growing a baby, keeping a baby healthy in utero, getting the baby out, and then you're just like, okay, now what? And you have no idea what just happened to your body or what to do about it. You feel horrible. And so I immediately became kind of passionate about just trying to fill the gap a little bit, and just trying to get a certain level of pelvic floor health as common knowledge, and yeah, just stuff that we deserve to all know. So that's kind of where I am right now. So I have a 5-year-old. I'm also 4 months pregnant currently. And so it's been interesting to, I had just started pelvic floor health as a pelvic PT when I was pregnant with my first one. And now this time I'm, even more practiced, and educated. And so it's been interesting, just kind of going through it myself, with the level of information, and just witnessing of everyone's experiences and stories along the way. So that is what brings me here today. Yeah.
Cool. So, obviously I really think pelvic floor is really important, not only in pregnancy and postpartum, but in women's life in general. But how important do you think it makes a difference for pregnancy and postpartum? Do you really think it makes a difference?
I mean, I think that we all in our bodies have vulnerabilities. And I think that pregnancy just inherently brings any and all vulnerabilities up to the surface because it is a huge demand on the body, as well as it inherently completely obliterates our core. So in that process, you've got like a big demand with no core. And so like anything's going to come to the surface. So a lot of people will start with a level of pelvic floor dysfunction prior to having a kid. And then they'll get pregnant, and then the awareness to the pelvic floor is already all of a sudden starts coming up. So whether that's in pregnancy or in postpartum, we start to realize how important the pelvic floor health is because we maybe start peeing ourselves or having pelvic pain with penetration, or we feel like our organs are falling out of our vaginas, and so it becomes like even more up to the surface and talked about because of like the inherent demand on the pelvic floor. With regards to like during pregnancy, how much of a difference it makes during pregnancy when we have symptoms, it usually means we started like closer to the threshold before having a kid. And so what we can do during pregnancy is oftentimes improve those symptoms, maybe not completely eliminate them because you're still very pregnant or getting progressively more pregnant, but at least make it so that there's not like any unnecessary pain and suffering during the process. So we're optimizing just the well-being of your body during pregnancy. And then we're also gearing up for the event of labor. I think that a connection to the pelvic floor and an understanding of the pelvic floor's role in labor is very helpful in entering into labor with confidence. So I always say that, it takes two players to have a vaginal birth. One's ourselves, which we have control over, and then the other is the baby, which we have no control over. So it's not like it's guaranteed if you do pelvic PT or you do X, Y, and Z that like you're gonna get the outcome that you want or the labor delivery that you want. But I think one of the biggest deciding factors of whether you get in your own way is whether or not you have the confidence and like just you can do it, you feel safe and secure in doing it, and pelvic PT can kind of help you get there with regards to your body. And then in postpartum, it's 100% necessary. I just spoke with someone today who's 2.5 years postpartum, and she's like, I pee myself all the time, especially when I cough or sneeze or laugh, and it's just not going away. And that is exactly what happens when we don't rehab our bodies after having babies. A lot of the time, sometimes it's a manageable level of dysfunction, like, oh, I just pee myself when I cough or sneeze. But then come perimenopause, when our tissues have less estrogen, all the dysfunction gets worse. And the next thing you know, like you are having more prolapse, you are having more back and hip pain, you are having more incontinence. And not to be like super morbid about it, but having to wake up and pee in the middle of the night, which is a sign of pelvic floor dysfunction, actually increases the risk for falling as we get older, which when we fall and if we break a hip, predicts that we're going to have a premature death within those next 2 years. So we can kind of connect it to like premature death. So I would say like 100% necessary in postpartum. Yeah.
So if someone hasn't had any pelvic injury, any trauma, really has, because I know we hold a lot of stress in our pelvis, and they really haven't had any trauma, physical, emotionally, or mentally, and you don't have any really signs and symptoms of any pelvic floor dysfunction, do you think it's still important to have like a map or a guide or an understanding of what's going on with your pelvic floor, even if everything is a-okay?
Well, I would question whether everything's a-okay too. Because I think like, for example, vagina owners and penetrative sex, like when we're in our teens and we have penetrative sex for the first time, we expect it to be painful. It's just like, oh, well, but then it's painful. And that's dysfunction, like, no, penetrative sex is not supposed to be functional or it's painful. Or like the individual who's like, I've never been able to orgasm. And that's just me. That's me. And it's like, no, that's pelvic floor dysfunction. Or the person who wakes up at night to pee for their whole life and that's normal. So I think some people don't even recognize like what is pelvic floor dysfunction, and they don't know that it could be different, if you will. So I would argue that like there's a lot of individuals out there that would say they're fine when ultimately they do have a symptom of pelvic floor dysfunction. And then for anyone who just doesn't have it, like actually doesn't have any symptoms, I mean, it's like, could we all benefit from, strength training? Could we all benefit from a massage? Like we can optimize our body's function, and we can in that optimize just how our body can function in the world for a long term. And so there's always a benefit. It just is on the scale of like how absolutely necessary it is to your well-being, or whether you're just like optimizing how you feel for the longest duration.
So in those since it's looks like in one way or another, it's going to benefit someone. At any point, should they like have a PT consult, or is there something that they can do totally on their own instead of going to a physical therapist? Or do you say that you should have a baseline? What is the go-to? Just getting some training, or is it good to go to a physical therapist?
Right. Well, I mean, I think one of the biggest problems is that there's so few pelvic PTs in America. And so even if you have the means of paying for physical therapy, specifically pelvic floor physical therapy, like it is an inaccessible service for many people because of the lack of pelvic PTs. So if anyone wants to become a pelvic PT, there's a huge need. I'm hopeful that moving forward, as we progress as a country, and as just the world, that pelvic PT no longer becomes a specialty, but becomes part of just traditional physical therapy training. And then physical therapists can choose whether they use the internal portion of it or not, so that everyone has the information and the knowledge, so that you could go to PT and that person's been trained. Whether or not, I think the big thing is that some people would not want to do internal work on people and other people do. So like chiropractors are all trained to do like an internal anal tailbone manipulation, but some do it in their practice and some don't. But they all have the information as to like when it's indicated that it exists, and they can choose to do it or not. So the problem is that it's pretty inaccessible, generally speaking. So because of that, like, yes, everyone, our physical with our like primary physician is pretty crappy, we'll say. So like, I think everyone would benefit from a physical therapist looking at their body, because we are the musculoskeletal specialists. And yet we don't all have physical therapists until we reach that threshold of like really not functioning in some form or being in a lot of pain. The pelvic floor is the same way. We'd all benefit from having one. And that's by far like the most, individualized, thorough way of knowing what your body and your pelvic floor needs. But it's not realistic too. So in that, I think there's a lot that can be done with education through things like this, where it's just understanding like what the pelvic floor is, what it does, what signs and symptoms of dysfunction are, and then like what constitutes pelvic floor health? Like, how do we get pelvic floor health at this like baseline understanding, right? Because a lot of people will be like, pelvic floor? What's that? And so if we can elevate that a little bit, through education, then I think that like that's a great place to start Thankfully, we do have access. Most people have access to internet. Most people have access to social media. I think there's a lot of pelvic PTs that are trying to get more information accessible out there because it's so hard to see one individually, especially in other parts. Like America is kind of the middle road. We have them. It's starting to be talked about, but pretty inaccessible still, versus like France is like, everyone's got one, but then there's other places like Germany where just like, don't say the word vagina, so it just varies, across the world, but, generally speaking, there is accessible information at this point through internet and social media, we'll say, varying degrees of accuracy, but
right.
at least something, right?
Right.
Yeah.
So there, even as a nurse, I have learned so much from you just from the anatomy. I mean, it's amazing what you can learn, and like there's aha moments. It's like, oh, that makes sense, And I think one of the biggest thing is that the core and the pelvis floor is so connected. And one of those key things that we need through life and through birth is our breath work, and how I remember being on the table and you go, okay, Margaret, breathe. And you're like, Margaret, you're not breathing. And I'm like, yes, I am. And you go, no, you're not.
Yeah.
So can you just go over a little bit, in words, what we need to do with our breath and what we're doing with our pelvic floor at the same time as we're breathing in and out?
I can definitely, let me get out my pelvic floor model. I'm just going to take the organs out of it. So everything red on this model is the pelvic floor. So it's a series of muscles at the bottom of the pelvis that almost create like a hammock. So bigger picture is that when we talk about the core, the bottom is the pelvic floor, the middle is the abdominals, and the top is the diaphragm. And we need core health and strength for literally everything. I mean, we can't have like arm strength if we don't have a stable core, like it literally can. Instability of the spine or core weakness can really be the cause of any problem in the body, we'll just say. So when it comes to how everything functions and how everything's connected, so you have the diaphragm that at rest is a dome shape. When you take your inhale, your breath in, that diaphragm contracts and flattens, or this is like normal function, what we need to be doing. So it contracts and flattens, and that creates the vacuum that brings the air into the lungs. What that also does is takes all of our intra-abdominal contents and pushes them around and down into the abdominals and the pelvic floor. So our abdominals lengthen or relax, and our pelvic floor lengthens and relaxes on that inhale. Then on our exhale, the diaphragm goes back to the dome shape, air is pushed out of the lungs, and we have no intra-abdominal pressure anymore. And so then the muscles of the abdominals contract a little bit, and the muscles of the pelvic floor contract a little bit. And the tension of those muscles are what stabilize the spine on the exhale. On our inhale, that intra-abdominal pressure is what stabilizes the spine. So when we're trying to reprogram the whole core, it really has to start with breathing, because the breath, or a diaphragmatic breath, really coordinates the entire thing. And majority of individuals are not diaphragmatically breathing these days. I mean, you kind of can get a sense there's a ton of different practices these days with an emphasis on breathing right now, because we've realized that breath is just like a prerequisite for so many things, and we all have pretty dysfunctional breathing patterns. So generally speaking, outside of the perinatal timeline, we tend to hold our breath or chest breathe, which is more of an upward breath, and a lift of the rib cage. And that is our fight or flight. That's our stress breath. And let's face it, like who's not a little stressed these days? So most people are kind of chest breathers just because of stress in general. And then in the perinatal phase, the baby tends to grow so big that it comes right underneath the diaphragm. So the diaphragm has no room to contract. And the rib cage tends to lift kind of upward and open up to make room for baby in third trimester. So most people in third trimester become chest breathers if they weren't already there prior. So we know that we have to reprogram this diaphragmatic breath. And the consequences of chest breathing, I think the one that you're kind of alluding to, Margaret, is that when we don't get any of that intra-abdominal pressure to come around and down into the abdominals and the pelvic floor, we never get pelvic floor let go. It just holds and tenses. So you kind of mentioned like we tend to hold a ton of stress here. It's because when we're in fight or flight and we're stress breathing, the pelvic floor is tensed and gripped. So it's very similar to holding neck tension, to clenching the jaw. We're also doing that in the pelvic floor. So one of the first things we have to do for the pelvic floor is facilitate a let go of that chronically held tension so that it has access to strength and just health in general. So breathing tends to be one of the initial things that we're talking about, because I could be internal doing massage and release, and I could teach someone how to do it themselves. But if they're chest breathing all day and gripping their pelvic floor all day, then they're undoing that in like a second. And so we have to try to reprogram our breath to be more of that diaphragmatic. And I'll put a lot of emphasis on like getting that intra-abdominal pressure air down into the pelvis itself, just to make sure that we're getting it all the way down. Because a lot of people will go to belly breath, which is more like breathing outward at the belly button, which doesn't get that intra-abdominal pressure to let go of the pelvic floor. Long-winded, pun intended.
So yeah, that's another, I think there's either your pelvic floor is either very toned to a degree, or it's very tight. And a lot of times we think Kegels or Kegels, whatever you want, however you want to say, that we need to enhance that. But if our muscles our pelvic floor is already tight, isn't that causing kind of an issue on top of, because we're not relaxing? And because from what I understand, to really have a strong muscle, we need to totally relax a muscle to have a strong contraction of it.
100%. And this is just the progression of what we've learned and understand about the pelvic floor. So back in the 60s, when the pelvic floor was discovered by Hegel himself, it was like, oh, muscles, oh, contraction, oh, Kegel or Kegel. Let's make sure we put it with a capital K because it is a name. And so that was pelvic floor health for like a really long time, was, do Kegels, just Kegel it, because that's literally all we knew. The unfortunate part is that as we've developed our understanding of the pelvic floor in general, a lot of people have not updated their information, and there's the messaging still very much out there of, oh, just do Kegels. But what we've learned, and every profession makes progressions. So even like some cues that I was taught in physical therapy school for like butt activation and like things have changed. We're ever evolving. We've really evolved with what we know with the pelvic floor, but we know now that like every single muscle needs to be able to relax and contract to have full strength. So a muscle that's too lengthened or too stretched out, like what happens to the abdominals, is going to inherently weaken that muscle. And then a muscle that is too tight or chronically gripped or tightened or contracted is going to weaken the muscle. So the pelvic floor specifically is supposed to ebb and flow with every breath we take. So inhale, it relaxes a little bit, lengthens. Exhale, it contracts a little bit, and it varies with how much it relaxes and contracts based on the demand on the body. So that is the normal like that's what constitutes normal function, is an ebb and flow with every breath we take. So that if you sneeze, the pelvic floor is in a relaxed state and has the ability to do this huge Kegel to be able to prepare for that huge amount of pressure with a sneeze. So like even more important for the pelvic floor is that when it's super, super contracted and gripped, it has no more room to go. And so it's super, super weak. And in that, like Kegels are either going to make you tighter, so they're actually going to make you worse off or worsen your symptoms, or they're just a waste of your time because you can't contract a contracted muscle. And so what we've learned is that we have to do what we call down training, which is make sure that we get that pelvic floor at a normal relaxed state through breath work, through internal pelvic floor release, through posture. And then we can put some strength on it. Right? So some pelvic floors, once they are like in a more relaxed state, they're like, oh, look at all this. And they just like have a normal strength Kegel. Other pelvic floors are like, I don't really know what to do with this. And so then we need to train the Kegel to tell the pelvic floor like, hey, like now that you've got access to it, like this is what we do. And so it's not that Kegels are like completely never done or talked about, but it is rarely ever. I mean, I'm just going to say like, I've never started with Kegels as being the first thing. So to have that be the messaging out there of just do Kegels is a disservice. So yeah, if there's one thing that I could have every single person know in this universe is, hey, let's do down training of the pelvic floor instead of Kegels and see where it takes you.
Cool. And another thing that you talk a lot about is the prenatal perineum massage. Can you just go a little bit into that and just give us a little bit of summary of that?
Definitely. So I get a lot of people that are like, I'm pregnant, I'm gearing up for labor and delivery, I don't want to tear. And so they'll have heard about perineal massage. And so I talk about it quite a bit. But so this is the perineum. It's a like group of muscles that kind of is the split between the vaginal opening and the butthole. And you can kind of see that if we're going to have a vaginal delivery, the muscles of the back half of the pelvic floor are really what stretch in order to accommodate a baby coming through. So the perineum specifically really has to lengthen in order to allow for a baby to come through, which is why we tend to get the most tearing in the perineum. So perineal massage is essentially being like, okay, well, we know these tissues need to stretch. So let's massage and manually stretch the tissues so that they're more used to or prepared to stretch for a baby to come through. I think the misconception is that if we do this, we're 100% guaranteed to not tear, which is not true. So there's conflicting evidence out there that suggests it might decrease the chance for grade 3 and 4 tears, which are kind of like the deeper, more extensive tears. But the grades 1 and 2, there's really no evidence to suggest that it prevents that. And then the evidence for the grade 3 and 4, the environment or the context of the research was everyone knew they were trying to reduce perineal tears. So we can't really apply that to all scenarios because it just wasn't a clean experiment, right? Because of that. So big picture is that we can't prevent tears, but if you want to do everything you can to prepare the tissue, then perineal massage is kind of the tool that we have access to. So if you're doing it yourself, we want to make sure anything that goes in is clean, so soap and water and lubed. So if you're doing it yourself, you would go thumb, inserting the thumb like from fingertip to about a knuckle in, and applying pressure downward until you get a sensation. not usually a good one. More comfortable one. And then you maintain that pressure as you kind of sweep to the outside to stretch the bottom half or even bottom 2/3 of the vaginal opening. I still do recommend perineal massage, even though it doesn't guarantee much of anything. And the reason for that is that I think the number one skill to have with regards to the pelvic floor going into labor is to be able to breathe into the pelvic floor and maintain a relaxed pelvic floor throughout labor, so that as you're pushing a kid out, you're not pushing into a tight wall. Now, the pelvic floor tends to react to pain and discomfort in a gripped, tightening way, because pain usually means something's wrong and needs to be protected. So you're making the conscious choice to override that reaction of the pelvic floor and breathe into the discomfort so that you can keep a relaxed pelvic floor. So perineal massage gives an opportunity to induce a discomfort that is similar to when baby crowns or the ring of fire, and practice breathing into it to facilitate pelvic floor relaxation. So, a sprinter who is going to go to the Olympics for the 100-meter sprint is going to train the 100-meter sprint. It's called training specificity, and it means that the best training is exactly the activity that we are training for. And so this is as close as it gets to having a similar sensation or discomfort that you're able to train yourself to breathe into and relax into. So that's why I still recommend it, but it is not proven to prevent tears. I think that tears can occur for lots of reasons that are out of your control. So a baby that comes out real quick, there's no priming of the tissue. So there's going to be maybe more extensive tearing. Bigger babies or babies that come out with fists by their heads, it's an awkward shape or a big thing, that's going to facilitate more tearing. And I think, our body's natural way of preparing the tissues is when the baby crowns and retracts and crowns and retracts, and does that quite a bit. But, oftentimes, especially in a hospital setting, once the baby crowns, people are really coached to get that baby out quick instead of hang out in that time with the baby kind of crowning and retracting. So there's lots of reasons that we still tear, that are a lot of them out of our control. But that's I think that's all I have to say about perineal massage. If you have any other questions about it.
So as you said, I think you even said 100% should people for postpartum really work on their pelvic floor with a physical therapist, or at least work on it somehow. So what would be something for one that has just had a baby? What would be some pelvic floor things that they should be considering?
Yeah, so I think it's important to note that it's bigger than just the pelvic floor, that your whole core was obliterated. We also lose single leg stability. So in third trimester, we start to waddle side to side. And so we lose our ability to have a single leg stance, and we lose hip stability in that too. So it's really the whole body has really been broken down. And then you're doing real awkward things. So there's usually a lot of mid back pain. We need shoulder blade strength. We need chest to be open. There's just the whole body really takes it, So I think initially, in early postpartum, the best place to start, because ultimately that's when we need to have an emphasis on rest. And the reason for that is that we have open wounds, where our placenta was, that need just rest to heal. We also have stretched out tissue, tissue of the abdomen or the abdominals, and tissue of the vaginal wall, which is where prolapse occurs, that just need rest and no gravity, no pressure to come back together a little bit. So really the emphasis is rest. And I think especially in America, where it's more, quicker is better and faster, it's the opposite in those first 2 to 4 weeks at least. So a great place to start, if you do want to feel like you're doing something for your body, is work on your breath work. Work on your breath work on finding neutral posture. So getting out of pregnancy posture. If you didn't have a cesarean delivery, finding your abdominals. I think one of the biggest things that a lot of people just assume is that, oh, I'm just going to go do this like core program online, or I'm going to go back to my core class. But if our brain stops knowing our abdominals during pregnancy, and so just because it's a core exercise, if your brain doesn't know the muscle exists and the muscles are like taking that opportunity to really go on vacation, then like it's a waste of your time. And that's where the messaging of don't do a crunch comes, right? And so like finding the abdominals is the first phase of abdominal strength that we can start right away as long as we didn't have a cesarean delivery. And then pelvic floor wise, in early postpartum, it is the most gripped it's ever been in your whole life because a huge amount of trauma just occurred to it. And maybe there's a tear in there or an injury that is protecting against. So breathing down into the pelvic floor, facilitating pelvic floor relaxation, and in that doing some like hip opening poses can be very beneficial too. So it's like, it's more about starting to rebuild the pillars of core strength, which is kind of posture and breathing, connecting to the abdominals and relaxing the pelvic floor, because you can't really put strength on your system until you've got all that kind of intact again. Yeah. So less is more. Yeah.
And I mean, I don't know if you're still doing this, but I did know you have some YouTube videos and an education for pre and postpartum. Are you still doing that as a video virtually kind of?
Yes. Yeah. So because there's only one of me and it's hard to get to see me and I'm about to go on maternity leave. I have developed virtual services and I'm actually working really hard right now to develop a few more before I go into baby number 2 world. But ultimately I have these virtual programs that teach you how to be your own pelvic PT. There's versions of it with where it's just you have access to the information and the strength programming and interviews with perinatal professionals like lactation and sleep consultants and all the things. It's very robust, we'll say. There's a version where you just kind of have access to the information, choose your own adventure. And then there's another version that actually has live weekly calls with me, just because I found the information's really consistent, like what everyone really needs to know about what happened to their body and what their body needs. But then everyone's individual body and experience is very different. And so the calls let me individually support a person and also hold them accountable for the stuff. And thanks to COVID, I've learned I can do everything virtually. So sometimes we'll do a live pelvic floor internal assessment and treatment. There's not like vaginas all over the screen. Everyone turns off their screen except for me. And I kind of have a model that I show with fingers and wands, where I kind of walk them through it. And then they're able to kind of tell me what they feel. I can tell them what that means and what to do about it. So super, super effective and definitely a more accessible service than one-on-one physical therapy. So yes, that is there. I'm also working on doing a pregnancy fitness program while I'm pregnant. And I will be bolstering up my postpartum one as I go through the postpartum strength building phase again. And then childbirth education. I'm trying to integrate what we need to know for childbirth education, but also pelvic floor health within it, because that doesn't much exist. And it's pretty baffling that it's not part of standard childbirth education. And then, yeah, just trying to bolster up just more virtual services that are more accessible. So people can go to my website, Jenny Putt, JENNYPUTT, PT.com. And everything that currently exists is up there. And then everything that I continue to produce, there'll be a couple months where I'm just continuing to put more and more services up there. And then it will be pretty stagnant for a while. So everything can be found there and people can
That's so exciting from a business aspect. You're getting passive income when you don't. So that's kind of
I
nice.
mean, I've learned that there's no such thing as passive income, really. It's just a lot of front end work. So what I'm going to be hiring someone to come in and do another pelvic PT to come in and do the live calls for me as I'm out. And it will be the first thing I return back to. I'm also having a person that I'm a personal trainer that specializes in perinatal that I'm currently training to be me. It's going to start running like live virtual workouts. I will keep a live component while I'm even out, but then ultimately some of the services will be without a live component for a period of time. But then things like the childbirth education, I ultimately will have a version that has like 8-week weekly meetups with a group or a cohort for more live interaction and Q&A rather than just watching recorded stuff. So yeah, passive income, but not. My bigger thing is just like improving accessibility. My one-on-one PT is so expensive. Insurance coverage is really variable. And like, I don't want you to have to wait 3 to 4 months in order to like get the help that you need. So it's kind of nice to be able to be like, you could start this today. And that there's no limit to like how many people can start this today. So that's ultimately my underlying purpose. Yeah.
Cool. Kelsey, I just want to know if you have any questions you wanted to directly ask Jen.
I just found this really interesting. I guess I kind of always thought pelvic floor therapy was needed after having a baby. So I'm kind of thinking like I'm 27, like anyone can really have a pelvic floor problem and without even really knowing it. So I mean, I do go to the gym, so I guess just exercise and breath work is what you would recommend. And then definitely I would recommend after having a baby to go see a pelvic floor therapist just to get everything kind of checked out.
Yeah, I mean, it's great to start even preconception for people. So I'll have some people come and they're just like, I don't have any symptoms, but I'm wanting to have a child soon. Like, what can I do to kind of optimize this vessel, right? To be able to get through pregnancy. And the more education that I can do in that period of time when someone's not pregnant and not early postpartum, it really sets them up for understanding what to expect, understanding what signs and symptoms mean, what to do about them. And it eliminates this, a lot of the times people end up in postpartum really devastated with what has happened to their body. And they kind of are like, wow, this is what I have to live with. And they didn't expect it because no one talks about any of it. And then they are, pretty much diagnosed with things like prolapse or diastasis recti or incontinence or whatever. And then there's nothing about what to do about it next. They're just like, oh, you have prolapse. And it leaves people into this like really dark place as they're like transitioning into learning how to be a parent. And all of that could be completely avoided if we can get the education to people much sooner about what to expect. And even like if you can try to maintain a connection to your abdominals throughout all your pregnancy, it's going to get harder, but then it sets you up for postpartum because you already know what to work on and you're going to find it quicker again. You know what I mean? Yeah. So I would say that like anyone who knows they're going to approach the baby growing world at any phase of it, could really benefit. And I would argue that the sooner that they can get the information, the better, just because it will set them up for both like mental and physical success with regards to their body.
Okay. And actually that made me think of another question. Like blanking on like lightning crotch, exactly what that is, but like, is that having to do with like a weak pelvic floor, or is it just where the baby's located in the pelvis that's putting that pressure? Or Do you have tips for that?
A few things. Yeah. So lightning crotch is just like your pelvic floor is on fire. It's not happy with you. You have a lot of pelvic pain. The lightning portion of it is typically because nerves can get involved. So when a nerve is compressed, either because of baby position or because of a tight pelvic floor or because of both, then it really like takes pelvic pain to this next level when we have nerve involvement. Hence the like lightning, because it is really sharp and shooting. So it really can have a pelvic floor tightness component. It's usually more tightness than weak. Well, I mean, tight is weak. So both, but it's like ultimately caused by tightness, maybe a hip mobility component as well. And then the position of the baby can be what makes it so that someone like has it and another person doesn't, even if they have a similar pelvic floor state. And so just some babies hang a lot lower. Some people engage some babies engage in the pelvis a lot sooner, right? So there's things that we can do to help try to manage the pain. For some individuals who maybe have a standing job and they're like 38 weeks pregnant and they have lightning crotch, I'm going to say, hey, like we can try these external support things to lift baby ever so slightly off of your pelvic floor, but ultimately this is your body saying it's time to go on maternity leave.
Yeah.
It's time to start laying on your side, and just unweighting the system in general. So we're not necessarily going to be able to always fix the culprit of it if it has to do with baby position. But there's always stuff to do to manage it a little bit better.
Perfect. Awesome.
Wow, thank you so much, Jenny. I really do appreciate it. And this will be a recording that's easy accessible to people too. So I know others will be really benefiting from it too. So I wish you the best with your rest of your pregnancy and postpartum and all that. And I'll be seeing you, I'm sure, soon. But and Kelsey, thank you so much for coming. And our next birth cafe is 12/12 at 12. And we're going to have Dr. Michaela Peterson, I think is her name. And she's got some real good expertise on tongue tie and stuff like that. So it'll be exciting to have her too. But thank you so much, Jenny.
Thanks for having me.
And we'll be passing this out and making it available. So thank you.
Awesome. Have a good one. Happy Veterans Day.
Yeah.
Thank you very much.
Yeah.
All right, guys. Bye.